there, this is Celia. I'm going to continue on with my Lyme story. In this video, I'm going to talk about what it was like being pregnant while having Lyme and the postpartum period for both of my kids. In the last video, I talked about how I had a bout of chronic fatigue for 5 months after I graduated Chinese medicine school and was totally depleted and worn out. So that's where this video starts. That 5 months of rest turned out to be wonderful, of course, but I didn't know it during that period. I thought that was going to be my life. I thought I would just have to find a way to somehow function while being so tired and needing to basically sleep from 10 o'clock at night until 4 o'clock in the afternoon. Now I would get up, I would have breakfast, I would get up and I would have lunch, and I would get up at 4 and eat again. So I had some good hours in the evening, but then I'd crash and go to bed. During those 5 months, I did work very intensely on treating anemia, which I had always had, and I also worked on raising my ferritin levels. Before, 6 months prior to that, my ferritin was, I think, at a level of 8. I basically had very little iron stores. And when I emerged from this chronic fatigue period, I think my ferritin was at 21. So it's significantly raised during that time, which was great. That's basically as high as I can get it. My doctor wanted me to be at like 40 or 50 before I got pregnant, and I just didn't think that was ever going to happen. Also, during that time of being in bed, I worked very intensely on treating leaky gut with herbs and food and nutrients and things. So I was kind of in this healing cocoon, and I had some things to take care of me, but it was really intense. But I was happy to emerge from that in the spring, and I suddenly had a lot of good energy. I felt wonderful. I felt the greatest I had been in a long, long time. So I got pregnant. My pregnancy went really well, probably just because I could sleep so much. I was starting my acupuncture practice, but even if I wanted to work a lot, I really couldn't because I was just starting. It's where I live, it's hard unless you have a number of different jobs. You kind of piece together 40 hours. It can be hard to work a lot just when you're first starting. It's kind of an organic growth situation. I was also enabled, supported, privileged to quit a side job that I had had for 7 years because my husband got a raise. Because of that, I was like, I don't have to work my butt off trying to start this herbal business and get it up to full time. I actually did get it up to full time, and because I'm a nerd and like accounting, I was keeping track of everything, and I could pay myself, which is great, but I could only pay myself about $100 a week in working 35 to 40 hours a week. Now, I could have doubled my prices, which I probably should have. Okay, well then I'd be making $200 a week, working 35 to 40 hours a week. That just didn't seem right. I could have doubled my productivity. I knew that there were ways, because I started as a hobby, and I was just time consumptive in what I did. I could have more streamlined processes. Let's say I doubled my productivity, I could make $400 a week. And at this point, I had the choice to be like, this is not worth it for me. I know this is going to deplete me. My husband's making enough money. I do not have to do this. I'm not going to kill myself over this by working too much. And so I could let that go. It's an interesting gray area because I feel like because my husband got a raise, I was able to drop my desperate scramble to make ends meet with my businesses. But as soon as I say that, I'm like, who am I kidding? I don't really have a choice. I can't be a workhorse, nor could I ever. My pregnancy went very well. I felt great. I slept great, which is rare and amazing. I just felt a lot more grounded in my body. I had a different kind of nourishing type experience happening. And because I didn't have to work 40 hours a week, I could lean into that. And I could rest when I needed to. I did have morning sickness. I could go into bed, go underneath covers, and do breathing and acupressure. If I was at a job, I wouldn't have been able to do that, and I would feel like shit every day. There was one thing that was very much Lyme related. It started out mild, and then it became severe SI joint pain and dysfunction. So my sacroiliac joint, both of them actually, were really bad. At one point, I was very afraid that I would have to lose my mobility. So some people who have sacroiliac joint dysfunction during pregnancy, it just gets so painful, your pelvis is all out of whack, and you may have to wear what is called a pelvic sling. It kind of wraps around your hips to keep everything in place, to kind of stabilize you because your joints are not stabilizing you. Or as people will have to use like modified crutches or a walker or a wheelchair, and or go on bed rest because the pain is so much. You just lose your mobility. And it was starting to get to that point where I had problems with driving in the car because I couldn't get in and out from a sitting position. So I had a whole team of people helping me. I had 3 acupuncturists that I was seeing. You know, they're my friends, basically. I had a chiropractor that I was seeing once or twice a week, functional medicine chiropractor, trying anything and everything. And I got body work once or twice a week. And it was only getting worse. So I do believe this is Lyme related because I had always had joint dysfunction. And my hips have always been messed up, and my spine has always been messed up. Lyme depletes collagen, and it just gets into the ligaments, and it just spells problems. It's interesting that SI joint dysfunction and kind of wear and tear is one of the indicative features of the beginning of ankylosing spondylosis, which I had been tested for along with RA and lupus many times. I could probably fit that picture, but I know it's not that. I know it's Lyme. Okay. But luckily, for some miracle, I don't know how this happened, but I found this book at the public library, just browsing a section on pregnancy, and I found this book that was called Relieving Pelvic Pain During Pregnancy. It was written by a Dutch physiomedical doctor, is that what they're called? Like a physical therapist, I guess. And it was all about sacroiliac joint dysfunction during pregnancy. So I took it home and I did the exercises. There were 2 main physical therapy exercises, and I did them, and lo and behold, I got better. I just shudder to think what would have happened if I didn't find that resource, because I was starting to get really scared about giving birth with my hips not functional. The birth was super intense and just one of the craziest things I've ever been through. I have a blog entry that I wrote about it. My son was in what is called sinciput, or military position. So his chin was not tucked. It was flat, and so he came out with a very broad part of his head being born instead of the kind of apex or top of the head that we're supposed to be born with, because the plates in the head mold very nicely to let you come out this way, but they do not mold very nicely to let you come out this way. They say that instead of dilating to 10 centimeters to have a normal birth, it is usually required to be a minimum of 11.5 centimeters to get out sinciput, because there's just that much less molding. And my son had to take extra long time in the birth canal during all those pushing hours to come out. Yeah, I pushed for 9.5 hours, and finally he came out. And I had broken my tailbone, and my pelvis was just in so much pain. So immediately postpartum was really hard. The first 3 days, first 5 days was like living in this foggy hell where I like didn't sleep at all, and I was in so much pain. I didn't know what was up or down. And then adding in there that my son had a tongue tie. Yeah, we got some methylation defects going on in our family. He had a surgery at day 7 to get that revised. But nursing was a big problem. So I was like cracked and bleeding trying to feed my baby, and I would have rather pushed for 9.5 hours all over again than endure the pain of every single time he tried to latch on. especially during that first week. So it was a very painful time and very tender, as is normal for postpartum. It's never really a walk in the park. I mean, maybe it can be for some people if you have a lot of support and you're really geared up for it. But I think it's normal to have some issues as you're learning the ropes. Mine just had a lot of pain, of course. But after like 3 weeks, my pelvis felt a lot better. I was starting to heal, and things got a ton better. And then also around that time, my son developed more like just the ability to suck properly, and the tongue tie was, healing nicely, and the nursing pain was decreased. Now, we still had pain for probably a good 2-3 months, but it was significantly better. So once I got out of that fog immediately postpartum, I felt great. I felt wonderful. I felt totally blissed out. I don't know how this happened. I've been a birth doula, or I had been a birth doula for 10 years. I've since retired. No more all-nighters for me. It's kind of, I just don't know, like, why I had such a great time postpartum, considering, like, my health, but for some reason I just did, and I'm not complaining, but I think it's a little bit of an anomaly. But there is one factor that I can think of. Well, two. One is I didn't have to go back to work. What did I have to go back to? So I didn't have to get the added stress of bringing my kid to daycare and getting ready in the morning and then like being productive during the day. That is a stress for me. Other people do better with that, and that's like their zone where they feel good. So for me, that's stressful, however, and I didn't have to put myself through that. I did start working a little bit around 6 months, and then 8 months, a tiny bit more. Basically, like just a few times a month, really, and slowly building up one patient here and there and whatever. Well, another thing is that I am used to having low energy and having lay in bed all day. So I was very comfortable doing whatever my baby was doing. So I'd wake up with him in the morning, we'd eat and have fun and play. He'd ready for a nap. I'm ready for a nap. So I literally napped with him and slept with him for probably until he was about 5 months. During that time, his nap started to get more condensed, and then I started to go outside more and like walk him around. But I feel like I needed that 5 months of just sleeping whenever he slept. And I was sleeping so good because of the breastfeeding hormones. I mean, oxytocin will put you out. So I had some help, and that was wonderful. Things started to get stressful in our lives when my son was 15 months, so a year and 3 months postpartum, when we moved into a house. We bought a house, which is great. I'm not complaining, but it was very, very stressful. The house was toxic. It was a fixer-upper that we couldn't really fix up. I got lead poisoning, even though I was careful doing everything perfectly. It's just a hard place to be, and we had tons and tons of financial stress. Now, this is a whole nother video in and of itself. How much it costs to have Lyme. So detrimental and sad and preventable here in the United States. It should not be like this. But the reality is, so many of us go through incredibly trying financial times. But what I will say is that during a 6-year period, like this past January, I was like, okay, since January 6 years ago, my husband Rob had, let me look at my notes. He had 8 different jobs and 3 times of being unemployed for at least 2 or 3 months. So that's like 11 different employment things, 3 of which are unemployment in a 6-year period. And every time Rob would look for a new job, he'd apply to a million jobs. He has to do all these like ridiculous tests and like whiteboard exams. He's a computer programmer. So they make you like perform and prove what you know and ask you these abstract questions. And every time he would do that, it's like the final week from hell. And it's so stressful on him, and it's so stressful on me. And I can just see it wearing him down and wearing all of us down. But then we're so desperate because we don't have enough money and we don't know how long he's going to be employed. In any case, it was a big, big stressor. Financial stress is really hard for a number of reasons, one of which is you just don't feel safe and secure. And that is really dysregulating for your immune system. Or at least it is for mine, because when we moved here, it was just all downhill. Okay, this is like the setup for me descending into the very, very bedridden, acute Lyme underworld was just simply moving to this house. There's like toxic, like old fake wood paneling. There's vinyl floor that I'd walk over and I could taste it. My tonsils are tasting it. And I have been chemically sensitive for a long time. And so I was just reacting to like disintegrating particle board. And, you know, we didn't see any mold, but there could be all behind the walls. We just don't know. There's definitely water damage. In any case, we moved here and I started to get sick. Became very exhausted and a lot of pain. Very dysregulated and inflammatory. A few months went on of me just getting worse and worse, and then this big part of my healing journey entered into the picture. And I'm not going to tell the details because I don't think it's appropriate in this video, but I had what I would consider kind of like a spiritual crisis at the same time as healing trauma. So now I have these 3 things to heal. I don't know about the Lyme yet, but I know I'm getting sick. And they're all piled on top of each other. And it was just really, really challenging. So it all kind of started with this acute spiritual crisis that kind of happened. I went through an experience of what I could best describe as a soul retrieval. I felt like some sort of soul surgery. And when this happens, it is well known throughout the world. It's kind of a common thing in other cultures besides the US of A to think this way. If you just like Google the side effects of soul retrieval, intense insomnia will come on there. It's just a really, really hard thing to go through to kind of do some really acute healing, I guess. And I bring it up here because it is totally related to my Lyme journey. But second of all, even though I do not have bipolar or schizophrenia, I don't even have anxiety or depression. I just don't really get those Western psychological symptoms. But I do think there is an overlap, okay, with what I'm calling a spiritual crisis. I say that because one of the symptoms of Bartonella is sudden onset schizophrenia and various types of psychiatric symptoms, which can be extremely severe. Now, people are going to experience that in different ways. One person may literally feel at risk for taking their life. Another person may feel literally schizophrenic. And then imagine if you start looking a little deeper. Somebody in that group, like myself, I don't identify with being bipolar or anything like that, but I'm going to say, you know what? I was going through an intense soul surgery. I'm not trying to say they're the same sort of things, but there's got to be an overlap. And there's a tie between some, but not all, psychiatric sort of presentations and similar aberrant things that happen to your psyche or your sense of self, okay? But I don't think they're exactly the same. And I just want to be clear about that. For instance, sometimes soul loss, your parts of your soul go away. This is kind of the framework which I'm talking about. Sometimes that's described as being very similar or the same as the Western psychological idea of dissociation, but it is not. They're not the same. We can't just interchange these words. They're different systems. However, we can use both of them as an analogy to explain what's going on. So that's why I bring this up. And then, speaking of the psychiatric type symptoms from Lyme and Bartonella, I also had burning hands and feet. And I felt like I was on fire. Totally just burning, inflamed, on fire all over my body. At night, my hands and feet they felt like I had flames coming off of them. They were so hot and red. I would close my eyes to go to sleep, and I'd be like, this is it. I'm finally getting over my insomnia. It's been 3 days since I've slept a wink. And I would fall asleep for like a second, and then I would have these dreams that would wake me up of all these bright red hot arrows just at 90-degree angles. That's what I was dreaming, and I'd wake up and I was like, I slept for 2 seconds, and then I had dreams about fiery arrows. Like, what? To me, does that not just have inflammation and co-infection all over it? I think it might be Babesia that has hot hands and feet, that burning sensation. I'm not sure, but I'm highly suspecting that as a physical symptom of co-infections. And also during this time of this intense spiritual crisis, I said I was also healing trauma. And I became like a trauma sniffer. You know, there's cancer sniffing dogs. Well, I became a trauma sniffing person. And my psychic abilities really opened up, and I was getting these kind of intrusive thoughts about everybody else's trauma. Well, not everybody else's. Very specific types of trauma, which are related to mine. So I was becoming aware of my traumatic issues that I needed to heal. And I also could catch those in other people. And it was so overwhelming. I was worn to a frazzle. I was regularly not sleeping 3 nights in a row. I literally didn't know if I was up, down, inside out. Like, I was like, where am I? I was so untethered. So that was a really intense time. And this went on for about 3 months during the summer. Now I had October and November and a little bit of December to kind of recover from that. Except I didn't recover because my 1-year-old was getting molars in and not sleeping at all. So I got out of that acute phase, but I still was really sleep deprived. And then I got pregnant with my second kid. And that pregnancy was very, very challenging. I was extremely exhausted. I had no idea how I was going to make it. I was regularly crawling on the floor because I couldn't stand. I was so tired. Yeah, because I had a 2-year-old, so I couldn't just like sleep like I did when I was pregnant with my first kid. I did get some child care for him, which was good. But during that time, I was trying to work and like be a functional person because I wanted that. I was still just in denial about how sick and tired I was. But I would say my energy level was maybe a 2 out of 10. And sometimes I was just a 1 out of 10. During my second pregnancy, the first 8 weeks of it, my son and I kept trading these illnesses back and forth. And one of them was influenza. So I had the flu when I was pregnant. And the sucky thing about it is, like, my kid wouldn't sleep at night because he was sick with whatever. And then he would finally sleep. Like, it's been 3 days of him being up at night with a fever and having to blow his nose. And he's coughing and he's choking. And I have to check his fever and give him water. Which I'm all for doing. He wasn't bad enough to go to the hospital. But I could manage him at home. It just took a lot of effort. So I got exhausted. And then I would get this sickness, and then I would be up all night with fever, having to blow my nose, not being able to breathe, coughing, and then I would get better, and then he'd get another sickness. Yeah, my pregnancy was really rough. Everything was fine. I was healthy. I was just extremely exhausted. And I say healthy, like, was chronically ill healthy. The type of healthy where you go get some blood work, and they're like, yeah, you're anemic, but, like, you don't have a real disease. But I totally did. I was starting to have Lyme during that time. So I started to have leg pain and foot pain, and that is a big Bartonella symptom for me. So that came when I was pregnant. A lot of issues with walking and standing on my feet, and it was very painful. And that lasted for 5 years. Just this year, 2022, I'm having times where that foot pain is going away. Took a year and a half of Bartonella treatment and 2 years of Lyme treatment before it to even begin to touch it. But it is recovering, which is good. But then I think, like, holy crap, I felt like that for 5 years, not being able to use my foot. Even if my energy was feeling good, it was still hard to go and, like, stand and clean my kitchen counters because my foot hurt. So, yeah, that was rough. I had allergies for the first and only time in my life, so there was about a 6-week period where I was not sleeping at night because of that. And I'm sure there's other things that happen. I just probably have blocked them out. But it was hard. I just remember being in tears, being so tired. So tired. The birth went way better. I pushed for about 15 minutes. Totally different than pushing for 9.5 hours. I basically didn't even push. She just came out on her own. And her birth is a huge story too. There was a lot of trauma that came up. It's like I had processed the last birth mentally, emotionally, but my body still held on to that memory. In any case, she came out. It was good. It was fun. As fun as birth can be. But then the pain started, and I had some very severe postpartum pain. Now, there is something called postpartum pain syndrome. Yeah, I guess I had that. I was in severe pain postpartum for a long time. I mean, probably 5 years, 4 years, but very, very intensely for about 1, 2, probably really intensely for 2 years. I was in very, very debilitating, overwhelming, unrelenting pain all over my body. So that looked like, for me, I had severe tailbone pain. God, I just tried everything for that. I had these like special pillows to sit on. I saw all these physical therapists. I did all this body work. I got moxa on my tailbone, which was amazing. Acupuncture, everything, heat. My pelvis was a mess, so painful. Every one of the bones was just out and in pain. My leg hurt, like I said, the leg and foot pain. My spine hurt. My shoulders hurt. My arms hurt. The tops of my shoulder and the neck was a big, big area. Like the trapezius was super, super, super painful. My chest hurt. My ribs hurt. A lot of like rib and breathing issues, which I think mycoplasma now. But just like the places where the rib heads attached to the sternum, like that cartilage there, was really inflamed, and like all of like the areas where the ribs would like flow over different membranes, it was just depleted and dry and broken. It hurt. I had such a hard time breathing. Kind of the worst pain that I had though was TMJ and kind of vagus nerve pain. Now this is a big Lyme symptom for me. When I am getting really kind of limey, I will get pain just like all over here and like this in particular. So just a lot of cranial nerve involvement, TMJ, teeth hurting, jaw hurting. And then I started to get headaches. And regularly my neck would go out. So I'd have to lay down in bed just completely debilitated because I couldn't move my neck. Yeah. Okay, I had to switch spots because of the lighting. There's my husband's vintage computer. My hair looks like red over here. So I had something else that is related to Lyme. I personally believe, or at least is related to Lyme for me, and that is I had a very inflammatory overproduction of milk. So I have a lot of friends who are in the lactation consultant world. I can never say the acronyms in a row, but it's International Board Certified Lactation Consultant. IBCLC. Okay. So I have a lot of friends who do that. And a true overproduction is quite rare. It's caused by hormones, perhaps the brain, and you make a ridiculous amount of milk. Like you make, I don't know what, I'm just going to throw this out there, like 50 units of milk. And each unit is like 4 to 6 ounces. So that's a true overproduction. But people who produce more than what their baby needs, and it is problematic but not a true overproduction, that was coming to light when my baby was, my second one, was born in 2017, 2018, is that is caused for the majority of people by high levels of inflammation and histamine. Basically, it's like the milk ducts and the mammary glands and everything are inflammatory and overreacting. I mean, it almost sounds kind of like a mast cell thing too, but I totally had that, and I definitely believe that it was related to my own picture of Lyme. Now, I have known people who have had severe seasonal allergies who make a ton of milk and had problems with overproduction. I've also known people who have had asthma and have done the same. So the atopic tendency, I think, can be very inflammatory. Anyways, I just bring that up to say that for me, I think that the Lyme and co-infection picture was a part of that overproduction of milk. That was problematic. I mean, we're still dealing with it to this day because my daughter never learned how to suck and swallow correctly because she just got so much milk so quickly. She had to push it away with her tongue in order not to, like, choke, basically. And she still has problems with all of that to this day. She had a lip tie as well. It did not need to be medically revised. Just want to bring that up because, again, another methylation defect evidence right there of somebody in our family. I personally haven't been tested, but, you know, sometimes that is a part of the Lyme picture. The two pregnancies were very different for me, and there are many, many factors for that. Anybody who has a kid and then they have a baby, it's probably going to be hard. I mean, not always, but you just automatically are starting at such a sleep-deprived, nutrient-depleted level already. So I think that's common, but Lyme was definitely playing a part in that for me. So one thing I want to bring up is that my first kid has no sign of Lyme. There's no reason for me to test him, not even a hint, nothing. Okay, my second kid has Bartonella foot pain and leg pain, or at least that's what I think it is. And there are some other things where she's not sick, so I'm not desperate to go get her in. We don't need to get her tested or treated right away. It is nowhere near an emergency situation, but it's on our radar. And I was super sick during her pregnancy, and she has signs of Bartonella, so I do not think that was a coincidence. I think I was very actively into having Lyme. It's enough for me to say, yeah, I was starting to get limey during that time. Definitely limey during the pregnancy. The postpartum pain I had, is it postpartum pain syndrome or is it Lyme? To me, it's Lyme. Talking about these pregnancies is important for me because it is a part of my Lyme story in that I just got super depleted from my nutrients and reserves of energy and everything. My immune system was really challenged. And my endocrine system and nervous system, of course, were challenged too. So it kind of set me up for a perfect storm for a huge Lyme crash. In the next videos to come, I'll get into the most acute Lyme crash that I did have in 2018 when I was bedridden from Lyme, intense full body migraines, and my body joints just absolutely not working. So that is to come. There still is a tiny bit more of the runway to that, which comes in the next video. Okay, thanks for listening. Take care. Bye.